factors responsible for infertility in females. We've talked about ovarian factors. Now let's talk about tubal factors and other factors. Tubal factors are factors relating to the fallopian tubes. So any structural abnormality of the fallopian tubes, that is abnormality in the structure, in the normal way that the fallopian tubes are made. It could be congenital. So any structural abnormality, it could be congenital, it could also be artificial or secondary, maybe as a result of any other thing that happens to the woman along the line of life. Yes, in a situation like that, there may be infertility. In case there is defective ovum, that is defective egg, or there is a problem with the pickup of the egg. You know that the finger-like ends of the fallopian tubes, we call them fimbriae or fimbriated ends. Those ends, that is where the ovary is. And when the ovary, the follicle matures and the egg is released, normally the egg is supposed to be taken by the finger-like structure and now moved into the fallopian tube or pushed into the fallopian tube. So a situation that there is a problem with the pickup of the egg after being shed, for it to go into the fallopian tube, there may be infertility. If the egg itself has problem, that also can come under ovarian factor. There can be infertility. If there is impaired tubal mobility or motility, that is any problem that could prevent the movement of egg along the tube, it can cause infertility. Now at this point, I want to talk about the possibility of the egg after being fertilized. Now supposing the egg now finds its way into the fallopian tube, then the sperm comes and fertilizes the egg, and now for the fertilized egg, the embryo, to find its way back into the uterus, if there is any factor that delays it such that the fertilized egg, as it begins to grow and grow big, gradually every day it begins to increase in size gradually. If there is too much delay of the embryo along the fallopian tube, it may get stuck in the fallopian tube. If there is also blockage, maybe the blockage is a partial one, even though the sperm found its way. The sperm could navigate its way into the fallopian tubes to a tube to fertilize the egg. But now, after the fertilization of the egg, the embryo now finds it difficult. It's bigger now, and it's more, I don't know how to put it, it's more robust and sac-like, rather than the sperm that moves and finds its way. In a situation like that, if there is delay along the fallopian tube, it is possible that the embryo gets stuck in the fallopian tube and it could not go again. In that situation, it will want to keep germinating, keep increasing in size, but there is no way it can leave the fallopian tube. And as a result of that, it grows and grows, continues to grow unto the extent that the tube can no longer contain it. When the tube can no longer contain it, it has to burst. It will burst. The embryo would also die. The embryo, don't forget, has become a child, but at that point, the embryo would also be suffocated, will be strangulated. So it will lead to a situation that is referred to as ectopic pregnancy. So that is why usually ectopic pregnancy is an emergency, because at that point the embryo has been strangulated, and of course in the process has also burst the fallopian tube. The fallopian tube has been burst open, and it results into bleeding. And that bleeding can be very, very severe. It also depends. Sometimes, if it is slow leaking, if the bleeding is not, so massive at the initial stage, it could take a period of time before it is even recognized or diagnosed. Okay? But in some occasions, the bleeding just starts, and before you know it, within less than 24 hours, the symptoms are quite pronounced, and the woman needs to undergo an operation to be able to open into the fallopian tube and stop the bleeding, and eventually ligate the fallopian tube, that particular tube. And when that happens, that tube is lost. So that means that woman is left with the second tube. So we need to take note of this. Things that could be responsible or could facilitate ectopic pregnancy, one of them is tubal infection. When there is infection of the fallopian tubes, when there is pelvic inflammatory disease, sexually transmitted infections, all these things contribute to blockage of the tube. Usually the blockage may be partial. That is why the sperm could find its way to fertilize the egg. Now, only for the fertilized egg to find its way back, it becomes a problem. So, in a situation that the fertilized egg could not find its way down into the uterus, the tube eventually is strangulated and it bursts open and bleeding occurs. That is what is referred to as ectopic pregnancy. So, if there is impact, back to fertilization or back to infertility. So, if there is impaired tubal mobility, there could be problem of infertility. If there is loss of cilia in the tube, cilia are just finger-like structures that line the tube, and they help to propel the egg as the fertilized egg moves into the uterus, as it rolls and moves into the uterus. These cilia, these finger-like structures along the lining of the tube, are the ones that help to propel the egg into the uterus. So if there's a problem with those structures too, cilia, there could be delay in the movement of fertilized egg into the uterus. It could cause ectopic pregnancy, and eventually anything could happen after that. Then partial or complete tubal blockage. If there is obstruction to the tube, I said in partial, the sperm could find its egg to fertilize, but the egg finds it difficult to come back into the uterus. So all these things are problems of the tube, and that could cause infertility. Now, the uterine factors. The uterine factors, there's also any structural abnormality of the uterus or the womb. Whether there is small womb, if there is too small womb, if there is narrowed, extremely long womb. Yes, in a situation that there is abnormality in the structure of the uterus, there can be infertility. If there is infrequent or absence of menstrual period, if the woman is not menstruating or the woman is not menstruating regularly, irregular menses, it could cause infertility. If there is uterine fibroids, sometimes depending on the type of fibroids also have different types. Now, there are some fibroids that will not necessarily disturb pregnancy, but there are fibroids that will disturb pregnancy, will not even allow the pregnancy to stay in the uterus, even if the egg is fertilized. So that can prevent pregnancy. If there is endometriosis is a condition that instead of the supposed cells, the cells that are supposed to be in the lining of the uterus, they are now growing. Those cells are developing outside the uterus, outside the womb. In a situation like that, the cells, the innermost layer of the uterus, the cells there, they have their own functions. But instead of being in the uterus, they are outside. If there is uterus